Welcome to today's talk, which will deal with illness and activism. Essentially, what I'll be talking about today is the role of activism in understanding illness. And I will be explaining this on the example of endometriosis and menstrual activism. Basically, I will tackle three major points. First of all, what are medical humanities? Secondly, what is endometriosis? And lastly, what is menstrual activism? Medical humanities is a relatively new concept, a rather new field of study. It's an interdisciplinary field of study, and it deals with the observing of the human body as an intersection of medicine, social sciences, arts, and the humanities. Basically, it's about putting the biological body into cultural context. To give you a very simple example of what this means, when looking at illness, for example, medical humanities look at the experience of the ill person. On the one hand, this includes the personal experience of one's illness. So the personal subjective experience of being physically ill and of the emotional and mental consequences of being sick. And on the other hand, this also includes and looks at the position of the ill person in society at large, especially if we look at the case of chronic illness. So we would look at the way an ill body is perceived, the way we experience illness, and how it differs in relation to gender, class, or race, as well as the very tangible social consequences of being ill in different areas of life. For example, the way that an illness affects your career, your education, or your interpersonal relationships. So, the goal of medical humanities is to inform medicine with the social and cultural perspective, thus bettering the application of medical knowledge on actual people. And I will illustrate what this actually means on the example of endometriosis.
Endometriosis is the presence of tissue similar to the endometrium outside of the uterus. So the endometrium is the lining of the uterus. This is what sheds during menstruation. And in case of endometriosis, very similar tissue can be found in other places outside of the uterus, usually on the outer walls of the uterus, fallopian tubes, ovaries, the bladder, and the colon, but it can be found in the intestines, in the lungs, and even in the brain. And this misplaced tissue behaves the same way that the endometrium does. It responds to the hormonal fluctuations, which are part of the normal menstrual cycle. And this causes a huge problem for the body, mainly because of the overproduction of prostaglandin. Prostaglandin is a hormone that the body makes as a response to illness and injury, and it causes inflammation in an effort to heal the body. Now, the uterus during menstruation produces prostaglandin, and this enables the uterus to cramp and to push out, to shed the endometrium. But in the case of endometriosis, because of the presence of the additional endometrium-like tissue, the body produces abnormal amounts of prostaglandin, turning menstrual cramps into labor contractions. The condition manifests as debilitatingly painful menstruation, as excessive bleeding during menstruation. It manifests through inflammation during menstruation, which causes fevers, vomiting, and diarrhea, painful sexual intercourse, chronic pain in the areas of the lower back, lower abdomen, and the thighs, chronic fatigue, bloating, and migraines. The symptoms are quite alarming, as you can see, but what is even more alarming are the statistics surrounding the condition. It is estimated that 1 in 10 women suffer from endometriosis. From the point of complaining about the symptoms to their physician for the first time, to the point of diagnosis and actually getting concrete help, we see an average of 8 years in the Western world and an average of 10 different physicians. Now, The question basically poses itself. If we have an approximate number of 176 million women worldwide suffering from a condition that we have known about for centuries, endometriosis was first mentioned as far back as the Hippocratic Corpus, why is it so difficult to reach a diagnosis? The answer to this question is twofold. It's both medical and social. From a medical standpoint, there are two major diagnostic difficulties. First off, in many cases, patients presenting with symptoms of endometriosis will be showing symptoms that are quite similar to those of ovarian or uterine cancer or polycystic ovary syndrome. Because these three conditions are much easier to diagnose, doctors will usually go through the system of elimination, which obviously takes quite a while the patient is still suffering without getting any help. The second and probably the bigger issue is the lack of diagnostic tools. We simply do not yet have technology sophisticated enough to be able to see endometriosis in a non invasive way. The only way that we can actually see the extent of the illness and be 100% sure that the illness is present is through a laparoscopy. A laparoscopy is not a major surgery, but it still is a surgical intervention. With this, it's not that we lack the means or the ability to develop better ways of detecting, diagnosing, and managing endometriosis, but the fact that there seems to have been, until very recently, no interest in doing this at all. The biggest problem with endometriosis is the alarming lack of research. Up until this day, we still do not know what causes endometriosis, when it starts, why it starts, or how it develops. We don't even know how to cure it. The only way to ease the symptoms is with a laparoscopic surgery, and this works only 52% of the time. In 2016, activist Abby Norman did a very simple thing to prove a point. What she wanted to prove is that the biggest issue with endometriosis is the lack of interest in research, lack of interest in the medical community to train and inform doctors. So what she did is she went onto PubMed, which is one of the biggest databases of medical research that we have today, and she looked at a simple statistic. There's the same amount of people suffering from liver disease and from endometriosis. But when you look up liver disease research, you see that there have been 30,000 pages of research published. And when you look up endometriosis, you see that the number of published pages is only 1,800. So what this inspired in recent years is a different approach. There have been several studies entirely independent from one another which interviewed patients. The interviews have been done with thousands of women diagnosed with endometriosis in North America, Europe, Australia, and Asia. And what these interviews were about is actually the perspective of the patient. They were asked to discuss their journey from experiencing symptoms to the first time to getting some help. And the results of these interviews are quite interesting and they are unanimous. Without any doubt, the number one reason for the delay in diagnosis is the refusal of doctors to believe in their patient's pain. Each and every one of the interviewed women stated that she was repeatedly dismissed as exaggerating or entirely fabricating her symptoms. This information changes the game entirely because now we see that the number one problem in diagnosing endometriosis actually is not in the lack of medical tools or knowledge. It is in the fact that doctors go so far as to not even believe that the illness is present when the patient is sitting right in front of them and giving them a list of the symptoms. This is the point where the problem stops being medical and starts being cultural. Menstruation is social taboo. We refer to our society as modern Western society, and in this society, this taboo is not as overt, not as obvious as in communities which we refer to as traditional or old fashioned or religious, but it is nevertheless there. It is visible in, for instance, the coded language that we use when we speak about menstruation. It's visible in the tampon tax, which states that menstrual hygiene and menstrual health products are a luxury, which should be taxed as a luxury good and not as a necessity. This is seen in the stigmatization of menstruating bodies, where people who menstruate are considered hysterical, emotional, weak, unreliable. It is seen in the representation of menstruation, which is under constant censorship in the media, in advertisement, in art, even in social media, as we have seen on the famous affair with Rupi Kapoor's Instagram photo. This leads to shame surrounding an involuntary, natural bodily process. One of the most dangerous consequences of taboo is a lack of information. Taboo stops the flow of information surrounding a subject. This leads to a lot of menstruating people not having enough information to be able to recognize that there is something wrong with their cycle, or it leads to a person not being able to articulate their problem. It also results in shame and anxiety around asking for help, especially from male physicians or loved ones. On top of that, we often forget the fact that medical professionals are members of society as well and are not exempt from prejudice or social influences. As we've established before, endometriosis is what we refer to as an invisible illness. Research has shown that as a result of the taboo surrounding menstruation, doctors who fail to prove that the patient's pain is a result of a more obvious disease slip into prejudice. Rather than looking for the less obvious answer, the vast majority of doctors revert to the old myth of hysteria, and the patient is dismissed as exaggerating or having mental health issues. So, what is the correct answer to the question, why is it so difficult to diagnose endometriosis? It's the fact that the combination of a lack of scientific research, inadequately trained medical professionals, social taboo, and prejudice is a recipe for disaster. Menstrual activism is what steps in to try and deal with the social side of the problem. Menstrual activism was a hot topic in relatively obscure feminist scholarship since the 1970s, but it skyrocketed as part of the response to Donald Trump's election in 2016. It gained momentum in the US, but then went on to spread across the Western world. I was very intrigued by this idea and didn't quite understand what menstrual activism was about at first, so I started following the movement closely. Soon I realized that the impact of the movement can be systematically analyzed if we define particular areas of impact. And I've noticed three major areas of interest and impact: politics of menstruation, anti consumerist activism, and representations of menstruation. The politics of menstruation is an area of activism which deals with highlighting the consequences of the cultural processes that turn menstruation into taboo. Activists claim that the fact menstruation is taboo serves as testament to the denaturalization of the female body, which is an active cultural process. The tabooization of a natural, involuntary bodily process characterizing only one sex reveals the position of said sex in society. It highlights the blatant sexism in the fact that while abortion and female sexuality are considered a public good to be institutionalized, sanctioned by laws, and discussed publicly, the biological realities of the body, which enable pregnancy, childbirth, and sexual intercourse, are considered a taboo and are left out of public discourse. It also highlights the othering of the female body and discusses the many violations of human rights which stem directly from the cultural process of othering. In essence, menstrual activism uses menstruation as a vehicle for the discussion of much larger subjects of body politics and power relations. Anti-consumerist activism is an area of menstrual activism that actively criticizes the consumerism surrounding menstruation. It advocates the ending of the tampon tax and the easy and free access to menstrual products for women in underprivileged positions. The movement also strongly advocates eco-friendly reusable menstrual products such as organic pads and tampons, reusable pads, the cup, and period-proof underwear. It also supports the creation of new and free cycle tracking technologies, which additionally educate users and enable self-diagnosis of reproductive health issues. On top of that, the movement has spun a number of online communities and nonprofit organizations which advocate for higher awareness surrounding menstruation, menstrual products, and work on providing free and easily accessible education about menstruating and the female body. Representations of the menstruating body is what I recognize as the academic and artistic area of menstrual activism. The main topic here is analyzing and discussing and challenging the representations of the menstruating body in film, media, and advertisement. The idea is to challenge the stigmatizing representations of the menstrual cycle and PMS in popular culture and highlight the relevance of representation. Another area is menstruation art, which is, as the name itself implies, the creation of provocative art representing menstruation with the goal of destigmatizing it and sparking conversations in the area of body politics. All the images used in the making of this presentation are examples of menstruation art, and you will find a slide with the names of the artists at the very end of this video. So, how does all this tie in together, and what sort of a difference does it make in the real world? Menstrual activism, with its activities in the three areas that we just described, effectively creates a space for endometriosis in public discourse. Menstrual activism is changing the public attitude towards menstruation and, by implication, towards the female body, female sexuality, and reproductive health. This creates a space for sharing knowledge and experiences, and over time, endometriosis surfaced as a hot topic. In the last couple of years, with the popularization of menstrual activism, we've seen an incredible rise in endometriosis awareness on social media and in mainstream media. And more than that, literature has a new trend: illness memoir. And the female centered portion of this literature deals with endometriosis. A lot of women started coming forward with their stories about the turbulent decades of looking for a diagnosis, and this not only makes for compelling reading, but it educates as well. And last but not least, we witnessed a simple case of supply and demand. A rise of consciousness about the illness has implications for the medical system as well, and not just for individuals. It creates a larger and more aggressive demand for solutions. The last couple of years, we've seen a staggering increase in endometriosis research as a response to all the media attention. On the medical side of things, we're finally starting to see some effort and funding going into looking for new pain management solutions, trying to understand the origins of the illness, and looking for better and more effective surgical solutions. On the cultural side of things, a lot of research is being done in the area of the effect of endometriosis on the economy. Researchers are looking into work productivity and how endometriosis affects it, as well as how much it actually costs women to be sick. There's also been a lot of new research done exploring the connection of endometriosis with mental health and the anxiety surrounding the diagnosis process and the ways they connect to depression. All in all, the case of endometriosis is a perfect example of the role of the humanities in society in general. The success of menstrual activism so far unmistakably exposes the connection between body politics and crucial social structures such as the healthcare system. It illustrates the need of multidisciplinary, intersectional, holistic approaches to problems that we face, no matter the area of life.
Normally, at this point, I would open up the floor to questions and to comments and facilitate a discussion. But seeing as we're doing this online this time, unfortunately, this is not possible. So instead, what I'm going to do is leave you with a short list of academic and non-academic texts that you can look at if you're interested in this topic. And the criteria for this little list is very subjective. These are works that I personally find to be very interesting and inspiring, and I would like to share with the rest of the world. And if you're a scholar or an activist or an artist working on a similar subject, or if you're simply a person that got interested or inspired and you'd like to share your thoughts and ideas, your experiences, feel free to reach out either through the Worth Institute or more informally through social media. Thank you for watching.